Aside from the Prime Minister and Qantas upgrades, the other big story today was the release of the government's report into the COVID pandemic response. By the way, I don't think it was an accident this was released today, because I think the government's looking for anything to distract from the Prime Minister's Qantas fiasco. Now, I've been critical of this COVID inquiry from the start. We need a full Royal Commission to properly examine what we got right and what we got wrong. But instead, the government handpicked 3 experts to have a look at it. Releasing the report today, the government announced they'll establish a Centre for Disease Control. Otherwise, the report on first glance looks like a politically convenient document. The left will use it to bash the coalition, saying the vaccine rollout was too slow. We've heard all of that before, of course, but what I want answers on is why we had to wait for that, really. Most of us didn't need a vaccine. The problem was focusing so heavily on vaccines and the way they imposed terrible vaccine mandates. Already, Labor's response to this report is dripping in hypocrisy. For instance, listen to Treasurer Jim Chalmers, the man who's delivered record government spending and therefore is having trouble getting on top of inflation. Listen to him on the COVID response and the economy.
Big decisions were taken and big mistakes were made. Those mistakes were costly and they were inflationary.
Well, of course the COVID spending was inflationary. Some of us said that right at the time, and we warned that we were spending too much money. But Labor wasn't doing that. Chalmers wasn't doing that. Chalmers was demanding the government spend more money for longer on JobKeeper. If the Morrison government had listened to Chalmers, there would have been more spending and higher inflation. But when it comes to the draconian measures, the report seems pretty soft. It does criticise the states for implementing very different measures when it came to lockdowns, borders, school closures and the like. Some differences were not easily explained, it said, and no rationale was provided. This included the operation of state border closures that states enacted unilaterally and that lacked consistency and compassion in implementation. Lacked compassion, you can say that again. But I guess my main criticism of the response was that it was way too tough. It treated the disease as if it was deadly to everyone, and it simply wasn't. And it treated the vaccines as if they stopped infection spreading, and they simply didn't. And these facts were very clear early, and the evidence only mounted as we went along. This report accepts this is the reality now, but it does so in pretty mild and forgiving language. Once more was understood about the virus threat and our healthcare system's resilience had increased, the pandemic response should have shifted from a reliance on the better safe than sorry precautionary principle, the report says, where fast actions not necessarily informed by evidence are required, to a risk-based approach grounded in evidence. Yeah, that's an admission they brought in measures without any medical evidence early on, as many of us could see and argued at the time, but government shut down dissent and much of the population was gripped in fear and went along with it all. Remember how they always cited medical advice, but they never shared it? That was scandalous. Still, the report goes on to say that governments should have toned it down. However, aspects of the response continued to rely on the precautionary principle, maintaining a low risk tolerance for COVID case numbers with inadequate consideration of the broader health, economic and societal impacts. Yeah, keep infections down at all costs, never mind people's mental health, never mind their ability to earn a living, never mind kids' schooling and socialisation, and never mind the inflation we'd all be wearing years later. You didn't need hindsight for any of this, yet the Health Minister now talks about trust.
Crucially, this report says that a number of the points I've already made about the lack of real-time evidence-based policy and the lack of transparency has driven a large decline in trust, which the panel members say, and these are their words, means that many of the measures taken during COVID-19 are unlikely to be accepted by the population again.
Yeah, well, I sure hope so. I really hope we would demand more information, we'd force more accountability onto governments and bureaucrats, and we demand that the media are more sceptical and honest. But I worry that's not the case. We haven't done enough to expose the mistakes forensically, and I reckon they could easily do this to us all over again. It's a huge worry. Let's bring in Professor Peter Collignon, infectious diseases physician, live from Canberra. Good to talk to you again, Peter. We spoke to you so often throughout the pandemic, and this idea that we should have, dropped the sort of knee-jerk response and gone to a more evidence-based response, taking into account those other social issues and society issues, that echoes what you were saying. But you were saying that from very early on, from perhaps 2 or 3 months into this pandemic.
Well, I think that's true. I mean, I think a lot of other people, or a number of other people, were saying as well. What the report shows, I think, says, is, look, we didn't take into account the social and economic costs, the cost on children of not having education, the cost of young people being kept away from work. All of that has long-term, social and economic costs. But if you actually make people poorer, their health expectancy often goes down, their life expectancy. So we never got the risk analysis right, in my view. People over the age of 80 were at high risk of dying. But if you were a teenager, your risk was very low. Yet we kept the same restrictions on everyone. And even at the time, a lot of the restrictions that we had, like you couldn't play golf, you couldn't go out fishing, you couldn't be outside for more than an hour, that was never sensible. And I think one of the problems was we were very successful in Australia compared to a lot of other places early on in 2020. So successful, we got to zero COVID. And then we had a whole lot of people who believe, we can do that forever. Look how good China is. Look how good New Zealand is. Well, it was always a false illusion, but that meant that restrictions were longer, harder than they needed to be. And again, your comment about the vaccine. We did have a vaccine available in Australia, the AstraZeneca one, and we could have vaccinated everybody at high risk, those over the age of 65, before it ever spread in any way. Yet we had a scare campaign by some of the zero COVID people saying, wait for Pfizer. But America was not letting it out of the country. So we had a vaccine that we weren't let available because people wanted zero risk, which is never available. And we didn't take a proper balance of risk versus benefit. And that actually stopped a whole lot of people getting a vaccine even when it was available.
Yeah, well, this is such a problem, the vaccines. Now, they focus big on the rollout, but my point is this, and you and I discussed this at various stages right throughout, and that is early on, yes, those vulnerable people in the community needed to get vaccinated or needed to have the opportunity to get vaccinated. But once everybody in nursing homes or over 70 or suffering other health conditions had been able to get vaccinated, they had that opportunity, we should have been opening up for the rest of the country. But we were waiting to sort of, vaccinate 80% of the country and more before opening up.
Well, I agree. I think, in fact, the vaccines did decrease transmission because they stopped people getting the infection, but nowhere near as much as people were promoting. And that got worse with time when Omicron came along. So I think the issue about being more open and transparent with data and having it in real time, which means you change what you do, was not evidenced during COVID. And we need to have that more evident. And I think that actually means any pandemic plan, we have to have before another pandemic, with clear levels of what you do at various things.
Yeah, we'll talk.
And we don't do that. And one of the real problems, this inquiry didn't really look at state interventions, which were the most restrictive, because it was a federal inquiry that I don't think the states were going to come on board.
Indeed.
But I do think we do need a royal commission that involves all the states and territories as well as the federal government, because we are likely to have pandemics again in the future. And if we don't learn what we did well, but what we didn't do well, we'll be in the same situation or worse next time.
Great. We'll come back to you again, Peter, and talk at this in more detail, because we need to talk about that pandemic plan and what this new CDC should do and all the rest of it. Thanks so much for joining us today.